All right, hello, everybody. Everybody can hear me? All right, good evening. My name is Margot Farrell. I'm the marketing director here at the Root Center for Advanced Recovery. Welcome to this year's community forum on teen mental health and development and the impacts of marijuana. We're really excited to have you here tonight. We may have one more of our panelists joining us virtually, but just to begin, we're going to have each of our panelists who are here introduce themselves. Just some housekeeping real quick. If you do have your phones with you, please make sure they're on silent. We are recording this, so folks who are not here tonight can be able to watch it back later. Also, if you need the restroom, out the door to the left, the emergency exits out the door to the right. All right, so without further ado, let's start with our very own Ashley Hickey.
Hi everyone, my name is Ashley Hickey and I am a clinic supervisor here at Root Center for Advanced Recovery. I currently oversee our medical office building in Middletown, which services our adolescent program.
My name is Halpern. I'm a pharmacist by training, but a cannabis buyer by profession now. So I started with Fettle, which is a locally owned medical marijuana dispensary in Newington. And now with adult use as of January 10th, all of our stores have gone hybrid, except our new Manchester one. And I stepped out of the store where I was a pharmacist and the assistant general manager to be a buyer for all 4 locations. So using a skill set that I did not learn in pharmacy school, buying a product that I did not learn about in pharmacy school. So really just took that degree and said, never mind, and trying my hand at buying it. It's been an exciting ride.
Hi, my name is Pat Rehmer. I'm retired. I highly recommend it. Prior to retirement, I was president of the Behavioral Health Network at Hartford Healthcare and loved that for about 6 years. And prior to that, I was the commissioner of the Department of Mental Health and Addiction Services. I was saying to some people earlier when I was the commissioner, as this topic came up, my favorite thing was that pretty much all I was allowed to say is we treat addictions. No comments about good, bad, we treat addictions. So this is a very interesting topic, I think.
Good afternoon, everybody. My name is Mayor Mike Walsh. I'm from the town of East Hartford and the mayor of East Hartford. But tonight, as we get into the discussion, I don't want you to think of me as the mayor. I want you to think of me as dad, the dad of a couple of daughters, and I'll weave some stories in that'll get you thinking about the mental health impacts of whether it's medical marijuana or recreational marijuana on the impact of a developing brain. I'm certainly not a scientist, but I've seen firsthand the impacts that it can have on a family, and I want to pass that story along.
Afternoon, my name is Laurence. I serve as the Director of Health and Human Services for the town of East Hartford. And various programs that I'm involved in include our health departments with programs and operations, and then various social services programs of all ages, including social services, our senior service programs, Parks and Rec, also with reorganizing youth services programming.
Thank you all, and I'd like to introduce our president and CEO, Steve Zuckerman. Say a few words before we get started.
Just a quick welcome. We are very excited to have you all here and those who are attending virtually. How many people we got virtually right now? 5,000?
19.
19, okay, not too bad. So again, really excited to be able to do this. I think this is our 3rd one. It's part of our Advanced Recovery Institute, which is about education, training, and building the clinicians and the providers of tomorrow. We have a great panel here today. Again, Pat Rehmer is also a board member. I don't know if you mentioned that.
Oh, I see that.
That's right. So that's a big thing. So she was my boss at Hartford Healthcare, and then she just liked me so much she wanted to be my boss again over here. So she's like, she's a board member. So what makes this so exciting for us is I think great things have come from these sessions. Our last one was on overdose prevention centers, and that was, I don't know how long it was.
Last year.
It was last year. And it created quite the firestorm in a good way. And I think we had here at that point Senator Saud Anwar, who was very invested and intrigued by that community forum, to the point that he put forth a bill to be able to establish a pilot of overdose prevention centers in the state of Connecticut. So we were the catalyst for that. So again, that was very exciting, and there's more to come on that. So I won't talk long again. Thank you all for coming in person. Make sure you grab some food and enjoy the evening.
All right, I think Mayor Walsh said it best earlier when you kind of gave us that little sneak peek of what you were going to discuss, and I think that might be fair to start with you and share what you're comfortable sharing and kind of get the ball rolling on this discussion.
So I think everybody has a few dates in their lives where something happened and you are instantly drawn back to that date. For those of us that are old enough, it was when Kennedy was shot, or maybe it was when Reagan was shot, or maybe it was when, I think it was the Challenger as opposed to the Columbia, the Challenger blew up. Those are dates that are ingrained in our memory. I remember when the Challenger blew up, I was shoveling. It was a January day. It was cold. We had an inch or so of slush. But I'm going to take you back to April of 2015. And I recall the date vividly. And we got a call from my daughter a few weeks earlier, and she was at college. And she wasn't herself. We weren't sure if she was just longing for home or whatever the case may be. So we had a planned trip to Florida. My wife went down a few days before. We figured, we would address whatever issue was there, go on to our planned vacation. We had some relatives down in Florida, but it was more serious. There were just some things that weren't making sense to us. Our daughter was struggling reading. This is a straight A student, top 20 or 25 in her class. And we're like, how can that be? So we withdrew her from college, and I flew down a couple of days later, and I'm going, what's going on? So we packed up her stuff. We brought her home. She was approximately 19 years old. And remember, April is the demarcation point. Everything before, I was kind of a normal human being. There wasn't, an impact on addiction or mental health in my life, nothing like that. Just humming along, and life was good. And we hit this full stop. Didn't know what it was. And I remember calling a few friends, and I said, my daughter needs an appointment immediately to a psychiatrist, psychologist. And everyone's like, well, we can take you in 6 weeks. No, we need somebody now. We went to Intercommunity Mental Health right here there in East Hartford. They immediately said, whoa, you need to bring this child to the hospital. So we first learned of marijuana-induced psychosis shortly thereafter on that night. And I can remember my daughter driving away in the ambulance, and Pat and I made another connection, and I'll circle back to that in a second. But she was brought to the Institute of Living, and I felt a sense as a parent of fear, of shame. I had no idea what was happening. And 30 days later, an inpatient stay at the Institute of Living, I still didn't know what happened. My daughter still didn't know what happened. We came out with an undiagnosed psychological event that resulted in psychosis. The doctors at the Institute of Living for the first trip were not my friends. We did everything we could to bring my daughter without regard to whether that was a good thing or a bad thing. We were panicked, we were fearful. And we are a loving family. We have great insurance. We're supportive of our children. We didn't know what was happening. Fast forward, she goes back to college. She ended up eventually finishing up her bachelor's degree. And about a year to the day later, so now we're 2016, it's April again. Exact same thing happens. She is, I don't know it at the time, but she has a marijuana-induced psychosis. And she is going door to door, and she believes she's Hillary Clinton. And I thought it was a bizarre story. 6 East Hartford police officers gently collected her up, and we brought her to the hospital again. It was a quick stay because she managed to recover on certain medications a little bit quicker. So it was 4 or 5 days. And eventually, within the week, we were back at the Institute of Living. The second 30-day stay in about a year, roughly 12 months apart, was a little more enlightening. We listened a little more. We weren't as much in fear. And we started to accept whatever was happening to our child, that we needed to embrace it. The tentative diagnosis was maybe bipolar, but nobody's quite sure. Fast forward about 6 months, again, she's back into the house. She's returning to school. She's on medication, antidepressants. There was an Ativan in there, and there was some antipsychosis drugs. And she's feeling sluggish. She's not at all liking the experience. And we land in the hospital again, a third time for about 30 days. Fast forward, because I don't want to be here all night. We have a lot to talk about. She had a fourth 30-day stay. And she came out of that one with the diagnosis of catatonic schizophrenia. We were floored, but, you know, things like, well, this is more controllable with medication than bipolar. So there's a bright light. But along the way, my daughter taught me about accepting mental health. It can happen to any family, mental health issues. And a lot of it is recoverable, or at least can be maintained. So we became friends with a lot of the doctors and a lot of the support staff. Here's the happy ending, which unfortunately doesn't happen to a lot of families. She never believed her diagnosis. And we didn't know to the extent that marijuana use was involved in her lifetime. There was even a card for medical marijuana use at a particular point in time, long before it became recreationally available. So our last trip was probably December of 18 or so. So here we are in February of 23. Over the next year to 2 years, she found a compassionate psychiatrist in West Hartford who said, your symptoms don't line up with your illness. You shouldn't, the medication should kind of wane. You shouldn't be able to go back to school. You're going to have trouble functioning day to day, and that doesn't feel like you. So she was on 8 milligrams. I forget what the medication was, but it was basically an antipsychosis drug. And they titrated her off. My daughter did a tremendous amount of research at the UConn library and said, Dad, this isn't, she wasn't telling me, she said to the doctor, this is not what I have. And the doctor titrated her off. So about a year and a half into the process, now it's probably the early part of 2019, she's at the dinner table and she says, Mom, Dad, I haven't taken my medication in 3 months. And I nearly flew off the handle, fell off the chair, whatever you want to say. I was alarmed, because the last thing you want to do if you're maintaining is to titrate or even come off your drugs cold turkey. I knew that was bad. So she says, here's my doctor, call him up. So I called him up and I'm ready to chew him out. And he said, listen, he goes, I've been working with your daughter. She's a lovely woman for the last 2 years. I just don't believe that diagnosis was right. There's so much we don't know about mental health. So she has been drug-free. She returned to UConn. She got her bachelor's and her master's degree in social work. And she taught me that there should not be a stigmatization of both mental health issues and addictions. So now I have come around to understand that it can affect any family. It has no boundaries. It has no borders. How I know that is, I am, as the mayor of the town of East Hartford, I was previously the finance director for nearly 25 years. There was something called Sandy Hook, and there are a number of first responders that really took it terribly, as they should. Some of those troopers and officers are not back to work. So Tim Larson, who was the former mayor of East Hartford, called me up and he said, hey, listen, I'm the chairman of the Public Safety Committee. He had Dr. Saud Anwar's seat before Dr. Senator had it. So he said, we're trying to write a bill, and we've been trying to write a bill for 5 years. So I said, listen, I'm going to get the police chief together because he represents the officers. I'm going to get our fire chief together. Both of them had long ties to state agencies that support police and firefighters. And I have long ties to CCM, the Connecticut Conference of Municipalities. What was happening in Waterbury was Mayor Neil O'Leary was at a standstill trying to write a PTSD bill. I went to Pat. We sat with Dr. Schwartz, who was not then retired, and we came up with the criteria of what a good bill would look like. Then there's 2 parts to it. The first part is we need to basically baseline some people that are going into the profession as first responders to make sure they understand what they're going to see and make sure they have an outlet for proper mental health care after they see some of those things. So we euphemistically called the bucket. How full is their bucket? Some people can tolerate a full bucket. Some people, you put a couple of drops in and their bucket is full. So Pat and Dr. Schwartz helped us to write the criteria. We then went to Waterbury because Tim Larson took a job in Governor Lamont's administration and we had nobody to deliver the bill. So on behalf of CCM, I said, listen, you're paying for this anyway. You're paying for people out of work who can't come to work. There needs to be a healing component. So again, if you're going into the profession, you get training to deal with your mental health issues that you will see from the things that first responders see. Secondarily, there's an annual test now for people that are first responders to test how full their bucket is. So those are two things that were put together. Thank you to Pat, thank you to Dr. Schwartz. We then handed it over to Neil O'Leary and CCM. They ran with it, and Governor Lamont, I believe in 2019, signed that bill for first responders in the state of Connecticut. So I look at my experience a little bit religiously. I believe God has a path for all of us. Mental health visited our family. There is a happy ending, but it was hell on earth for the better part of 5 years. So anybody who doesn't believe that there's linkage to smoking marijuana and psychosis, or even an entry into schizophrenia, maybe on a small scale, but it's real, it's there, our family delivered it. We do have a happy ending that resulted in some groundbreaking PTSD legislation for the state of Connecticut. But when I got invited to sit on this panel, this is a story everyone has to hear, because they have to weigh if the possible outcome of smoking marijuana is worth the possible damage that you can do to a developing brain. So this guy doesn't want anybody to touch it till you're 26 years old. I believe in, personal freedoms, but it was a gut punch for our family, and I wouldn't wish this on our worst enemy.
Thank you, Mayor. Pat, I'd like to have you follow up on that. Just, you're a nurse by trade. You have a ton of clinical experience, especially in the psychiatric world. When you hear that story, what experiences can you bring to the table based on that information? What have you seen?
Well, a very personal one, actually, that I had forgotten about, but when you said you remember certain dates, it popped into my head. My brother, this was many years ago. My brother was probably 17, so I was 16 at the time. It was Easter Sunday, and he began to act extremely paranoid, was accusing my mother of trying to poison him. We all knew he smoked pot. And eventually he ran up into the woods with a knife. My parents called the police. Of course, then you've got a knife with the police, and then you're in a whole nother dimension. Anyway, he got hospitalized briefly as well. Same thing. Young man, perfect age for a diagnosis of schizophrenia. Sure as hell looked like that. And yet within a week, he was hospitalized at then Elmcrest Hospital. And came out, never had another episode again. So I very early became very, what's the word?
Skeptical?
Skeptical, and also aware of the impact of drugs. But the other thing I was thinking was, there was a young man on an inpatient unit when I was first a nurse manager, and so this was in the 80s. The Institute of Living was a long-term hospital, 400 beds. People did not leave. It was, I have to say, I loved it. You really knew your patients very well. But it was before the second antipsychotics came along. So we did a lot of stuff that when I look back, I'm not proud of. But there was this young man who we all just adored. And he would frequently come to the nurse's station and say, I only smoked one joint. I have to tell you, at the time, we were all like, that's not really what happened. But in retrospect, years later, I thought, I bet he did. Because I have seen a number of young adults who smoked for the first time or the second time or the third time and became psychotic. I mean, for me, the biggest message, the one thing that I would say is that if we can keep kids from trying anything, including cigarettes, until they're 21, we decrease the incidence of addiction for them by 97%, even if they have someone in the family. So that means no cigarettes, no alcohol, no nothing until they're 21. Now, I have two 30-year-olds. First of all, I didn't know this. Maybe if I knew it, I would have beat it into them a little bit more. But I didn't know it. And, we had our challenges, obviously, when they were growing up. My daughter, luckily, has a little bit of an anxiety disorder. And when my son said to her, how come you don't smoke pot? She said, have you met me? So we never had to worry about her, but I do think that for me, the issue is the adolescent and the young adult brain. And we do know that that brain continues to develop until kids are 25. And so I do worry about people under the age of 21 or 25 using pot, and it can mess up your brain. I think when you get out of adolescence, it's a different conversation, because I can make the argument that it's probably not as detrimental as alcohol for people in the long run in terms of health risks, right? Although the smoking is a big issue. But I do think that keeping adolescents away from this is just critical. And it is more challenging, I think, as people have it in their homes more now. And how do you think about that? We all, for years, if you had kids and you had a liquor cabinet, I mean, my parents had a liquor cabinet, it was kept secured. And not everybody's was. I remember friends in high schools whose parents didn't secure their liquor cabinet. It wasn't a good thing. So, I think that there are steps that people really, really have to take if they are adults and choose as adults to use this. But when we come to young adults and adolescents, for me, it's an absolute no.
Thank you, Pat. We also have one of our panelists joining us virtually, Dr. Surita Rao, a psychiatrist, and she specializes in addiction. Can you weigh in, Dr. Rao, here now following up another clinical point of view with what you just heard off of Pat discussing? Obviously, we know the adolescent brain is developing, into the mid-20s. What is your take on this?
Thank you. Sorry, I'm not there in person. I really apologize.
Hold on 1 second.
Yeah. So, I would agree with, thank you for sharing these very personal stories. I think they do make a difference instead of just having data.
Hold on 1 second, Dr. Rao. We're trying to fix the audio here. You want us to circle back with you guys, move on to another question, come back? All right. We're gonna get the audio figured out. Dr. Rao, just stay with us. We'll come back to you.
Okay,
I'd
sure.
like to get the pharmacist perspective now, as you work in you work in a dispensary. You said you're on that front. And I know when we had spoken, you told me that there are certain things that you put into play to obviously make sure that kids, adolescents are safe. What can you tell me with your background when it comes to marijuana, both medicinal and recreational? And what you guys do to prevent this from becoming a problem and seeing situations like we were just hearing about.
Sure, Margo. So first of all, when the program started in Connecticut in 2014, it was just medical. And they modeled the medical marijuana program after the existing pharmacy regulations in Connecticut. They essentially took the pharmacy model and regs, took out the word medication, inserted the word marijuana. And there you have it. A medical marijuana program was ready to stand up. So the products themselves are all stored in the back in a vault, even more secure than a pharmacy, under a heavier lock and key, one might say. Products only going to the sales floor when one of our patients or now adult use customers is actually completing that transaction. Getting into the dispensary when it was just medical, you had to have a medical marijuana card and be registered to even enter the sales floor. So it's not like a typical retail environment where someone could come and grab something off the counter and try to make out with it. It's not like they could go like in a liquor store if they tried to sneak in and sneak out. Very, very well secure. And then now with adult use customers, every person has their license scanned. So it's telling us that they are 21, that it is a valid license, and of course, making sure the person handing it to us is the person on that identification. With the medical marijuana program, there's always been limits as to how much a person or patient can purchase. With adult use, that's been decreased down significantly, so people can only purchase so much at a time. All that being said, these products absolutely do get into homes. They need to be stored securely out of sight of anyone who could potentially get into that product. They are in we dispense everything in childproof packaging. So The products themselves are very, very difficult to open, just like a regular prescription or over-the-counter bottle. In Connecticut, when the adult use reg started to come through and the program was about to stand up in January, the producers all had to switch to very, very plain packaging. So if anyone's seen pictures of products in California or Oregon or Washington, they can be extremely inviting to children, literally saying something like Skittles on them or having, you know, characters or cartoons on them. In Connecticut, it looks just as boring as a prescription medication bottle. So there isn't any artwork, there's no bright colors, it's literally just black and white on a sticker and then a black or white container. With all of this, the pharmacists in the store are responsible for making sure that the products are stored securely. There's inventory audits every single week where the entire vault is counted to make sure there's been no diversion. Patients have the opportunity to talk to a pharmacist when they join our dispensary. So we talk to them about these storage considerations. And then with the adult use customers, they are only able to leave with product if they've like I said, had their ID checked, haven't exceeded the amount they could purchase that day. There's really no ifs, ands, or buts. So we've even had the Department of Consumer Protection on site when a patient arrived without their physical driver's license. And technically we can't let them in. Even if we know them, they're a regular, they have to hand us a physical government issued ID. So they saw us deny this person got very upset and said some things they probably regretted later. But we stuck to it, and that's how we operate. That's how the dispensaries operate with this pharmacy model led by pharmacists who we are just, compliance is ingrained in our DNA. So having the pharmacist model applied to the medical marijuana program made a ton of sense. We have an adult use only store in Manchester. There are stores opening that are adult use only, do not have a pharmacist on site, but still have the exact same storage requirements with a vault, as well as all the same ID checks and balances for any adult who's entering the facility to purchase cannabis.
All right, thank you. Ashley, I want to ask you, with your clinical background and in your counseling, sessions that you have with adolescents, do you think that having it legal, having that term legal, impacts what a child thinks about it? Maybe how severe it is and, what it might do to them?
Yeah, so I think in working with adolescents and my experience with adolescents, I think when you throw the word legal or illegal in front of something, it can oftentimes be more exciting and cause more attraction to what that thing is. In my experience, I found that it doesn't matter what the word is in front of it, if it's legal or illegal. It's about peer pressure, and it's about what is being given and offered in their peer group and in their social group. And I think that there is a lack of education with what this thing or what this item that is very exciting and very new is going to do to them moving forward or long term. And I think that given all of the things that are happening with society and in the world and in the school systems that I've seen, there is this controversy of, should I, talk about that I'm using marijuana? Should I not talk about that I'm using marijuana? And how does that impact my life moving forward?
Have you seen specifically with any of the teens who come through into your clinic having a negative impact? Have parents disclosed, my child uses marijuana? And how has that kind of changed the trajectory of their recovery that they're coming to your clinic for?
Sure. So we use a very harm reduction model in our clinic. And I think that when parents come in and they hear that their child is using marijuana, there is this initial reaction of, what am I going to do? How do I stop it? If I put in all of these rules and regulations and kind of put my foot down, is my child going to use it even more? Like how do I as a parent step in and be a parent, but also not push too far where they're not going to tell me anything? And now I have to be concerned of, is my child doing something that I'm not aware of? And when we work with the adolescents and we sit down and have these conversations of, okay, so you're using marijuana, and okay, you may be excited about it, right? And you may not think that this is harmful to your life, but talk to me about why you're using it. And what led you to use it in the first place? And are you using it as a recreational thing? Are you using it because there's some anxiety or peer pressure, or is there some depression linked to it and this is a coping skill? And I think addressing it in a way of finding the root of why it's being used to then provide education has not only helped us with working with adolescents and in the clinic, but also assisted parents and families in understanding substance use and mental health and how they're connected, and then providing interventions and strategies moving forward on maybe not necessarily talking about eliminating the marijuana, but pulling in all of the support systems to talk about it as a whole instead of just the substance use on its own.
Definitely an interesting perspective to take in, and we do have Dr. Rao now who's able to communicate with us. So let's circle back. We're going to get the psychiatric perspective. Dr. Rao, I'll turn it over to you.
Hello, can you guys hear me?
Oh, don't tell me Jen's still here.
Can you all hear me?
Oh, hold on.
Can you hear me?
No, we just got it.
What about now? No?
Back again.
So can you guys hear me yet or no?
We can't hear you. Joe's gonna keep working on it. I promise we will get to you. You did have it
Well,
figured
you know
out.
what? You could have Stephen call me on the phone.
Yeah, it's loud. All right, well, Laurence, we'll hear from you here. You know, with your experience in public health, and I know obviously with Mayor Walsh here as a counterpart for you in this big initiative in your community, and obviously we hope it would be across the state and the country as well. Can you speak a little bit about, I know when I first reached out to you guys, you were looking to implement surveys and research and do things like that in your community. So talk a little bit about what that's yielded and what specifically you guys are trying to gauge.
Sure. So from a public health perspective, you know, you look at the core principles of our area of practice, you're talking about assessment, policy development, and assurance. And so with the assessment part, data collection is important so we can make evidence-based decisions. And you know, you can look at some national data as well as local data, which is very helpful. And so just to kind of give you a little bit of perspective of some information that's been coming out, when you look at youth risk behavioral surveillance system data, which is a national effort to understand the prevalence of certain behaviors and conditions, some of the 2021 data that's just coming out of CDC indicates that when it comes to high school age students, about 16% have reported within the last 3 days of their survey that they would have initiated or used marijuana products. Now, promising in one regard is that that's kind of stabilized in the last 10 years. But unfortunately, you're seeing kind of a difference based on the age group that's referenced in the high school age. So younger, that 9th and 10th year age group, not so high. But when you talk about as far as numbers of prevalence reported, but we're talking about our juniors and seniors, close to 30% reference recent marijuana use. And so that certainly gives you perspective about how common the practice is. We took a perspective of understanding the perception of marijuana use among teens when we partnered with our East Hartford Public Schools, our youth services and our public school system, deployed a survey out through our health programs, and they got more than 1,200 responses from students, which is a great sample to help us understand. And, you know, some of the things you look at it, you kind of wonder, you know, surprising or concerning. I would say in some ways concerning. For example, when we asked respondents if they feel like their peers are more likely to use marijuana products if it were considered legal, 70% said that they're more likely to consider it safer or to initiate because of being legal within Connecticut. When we asked respondents if they feel like their peers are approving or strongly approving of use of marijuana products, 1/3 of students referenced that they feel like their cohort either considers use of marijuana as you know, approving or strongly approving you know, activity to engage in. So you know, I would say that we really have to look at this as from a policy perspective, assuring that we really try to work with our student population, our adolescents, to make sure that they understand the risks, especially when we're talking about marijuana use. Because another key point from the survey that we identified was that when we asked students how frequent among their peers that they know that are using marijuana products do they use it? Is it daily or just weekly or rarely? 56% reference daily use, that they suspect that their friends and colleagues are utilizing marijuana products. So it seems like even though it may be you might argue a somewhat limited number, but it's still kind of increasing in frequency potentially among adolescents, which is very concerning. And we definitely know the outcomes from studies that are coming out. You know, we know, as what's already been talked about as far as marijuana-induced psychosis, you know, the association with certain mental health conditions like depression, suicidal ideation, but then you also have long-term implications as far as poor academic performance, inhibiting with learning overall, higher occurrence of high school and college dropout rates. You know, these are very concerning because we have long-term impacts, not just during the immediate use, but also long-term use. And then we have to consider the risk when it comes to health, with increased risk of certain cardiovascular disease conditions and lung disease. So from our perspective, looking at this, we want to ensure that we're taking that educational approach for ensuring that both adults and students are understanding the risks involved with marijuana use, whether it be very infrequent or frequent, that they can make a really informed decision and assure and certainly agree with everybody in the panel that really, you know, adolescents and teens should not be using at all, but they need to know about the risks even going forward into early adulthood when they can make that choice, that they make an informed decision about the risks they're still taking on from potential use of marijuana products.
All right, well, that data is certainly insightful to letting us know how many are actively using it or considering it. We are going to get really high tech here. So Surita is going to be joining us from the phone, and I'll hold the mic up, and then the folks on Zoom, I'm told they can hear her fine. So Dr. Rao, thank you so much for joining us. Take it away.
Okay, well, is there echo in the room?
You're
Oh,
good.
it looks like we don't need the phone. Look at that technology.
Okay, great.
Yes,
So you can actually hear me?
we can.
Okay.
Perfect.
I'm so sorry that I'm not there in person. I got my days mixed up. I would have driven out there tomorrow, but so I really apologize for that. But thank you for setting up the Zoom, and thank you for everyone who shared their perspectives, including personal stories, which I think always do have a stronger impact than when we talk about data. Although data is important too. So as a addiction psychiatrist, I would say that two things. Two major things. One, I would say, is that, you know, just marijuana is on its way to becoming legal across the country. So, you know, it's already legal in many states across the country, and it's the number of states where it is on its way to becoming legal is sort of, you know, increasing by the day. And so we have to kind of accept and work with this new world where we have another legal drug. So we have alcohol, we have nicotine, we have, you know, gambling, and now we have marijuana. So the thing is that if let's just take alcohol as a parallel, although by no means am I saying that marijuana is anywhere near as you know, dangerous as alcohol when taken in large quantities. But if you have a family history of you know, if you have a family history of alcohol use disorder, where you had a grandfather who suffered from alcoholism, or you have a mom or dad who suffers from alcoholism, or you have any family history of any kind of addictive illness, the genetic loading is it's a very there's a strong genetic component to any kind of addictive disease. So for that young person experimenting with any kind of addictive drug in high school, whether it's alcohol, marijuana, whatever it might be, is far more risky than it is for their friend who has no family history of addiction. Can the person with no family history also end up having trouble and getting attached to it? Yes, but it's a lot less likely. And so that's one thing to think about. And I think for parents, if there is a strong family history, or if there's any family history, it's important to discuss that openly with your children, just the way we would with heart disease or anything else, saying, you know, and just the way we would with heart disease or diabetes or whatever else, to kind of take the stigma out of that, and say that, you know, this is less safe for you than other people. And then the other thing I would say is that, you know, it's very, very difficult for teenagers. Like, there's so much use of marijuana, alcohol in high school, in college, and other drugs that I think we live in a world which is like washed with drugs. And so to have a genetic loading, then the only way to stay completely safe is to never use anything. And I think that's a real challenge in today's world. And I think whether they are buying like marijuana legally or illegally, like what different, I mean, ultimately, once it enters the brain doesn't know the difference. Then I would say the other group that's really at high risk, are the personal examples that people have mentioned, where for the average young person, using marijuana is very unlikely to make them psychotic. It might at some point, a few years down the road, make them paranoid. I've met patients where they used marijuana for years and it always like calmed them down. And then one day they had like, panic attack, or they became completely paranoid and they actually never used it again because it was so unpleasant, the experience. But there's a whole group of people, and it's just their brain and to some extent their genetics, where they have the vulnerability to psychosis. And so for them, marijuana is extremely dangerous and can trigger off episodes of like severe psychosis. And if they have any kind of latent risk or propensity for really serious mental illness like schizophrenia, then the smoking of the marijuana, not like one joint, but smoking it over a period of time, for that group of young people could trigger off like the beginnings, it could trigger off schizophrenia sooner than it would otherwise have happened, or maybe it would never have happened. It's hard to say. There's no studies to show like what are the differences, so to speak. And I think a lot of times we see patients coming into the emergency room, coming into the hospital, coming into outpatient clinics where they have become psychotic after using marijuana, and then they just can't stay off of it. And so then the brain never has a chance to recover, and the treatment team never has a chance to see what do they look like without smoking marijuana for like a month, because they're just unable to stay off of it. And so they end up on antipsychotics, and then eventually it just becomes kind of a chronic condition. I've also had this interesting experience since I was a resident, which was so long ago, where parents will bring in like a young person, they don't have to be 15, they could be 20, they could be 21, they could be 19, they could be 22, 18, whatever, and they're totally psychotic. And you tell the parents, we're going to do a drug screen and let's hope we find something in there. And the parents are like, oh, no, he never uses anything. That would be terrible. And you're like, no, that would be a good diagnosis, because then you have like a lot of hope for the future. Whereas if there's nothing in the drug screen, then we're looking at first break of schizophrenia. So, but I've also seen, what was mentioned before, as a psychiatrist, I've seen where people are diagnosed with some kind of severe mental illness. And then, if they're clean for a period of time, they agree to go to rehab and they don't use anything for 3 months there. And then, suddenly they're completely like fine after a few weeks without medication.
To that same effect, can you also speak, I'm sure everybody in this room has probably heard the old adage of it's a gateway drug or there's no withdrawal symptoms. And I think now, especially with the potency of the marijuana that's out there medicinally, recreationally, we are seeing an uptick in that. Can you speak a little bit about what specifically adolescents who are still developing may experience in terms of maybe they have that genetic loading and it sets something off? How likely are they to maybe transition to another drug? And if they are coming off of it and they maybe do go through those uncomfortable symptoms, how likely are they maybe to relapse and start using it again?
I think everything that's potentially addictive has withdrawal symptoms. I think when people say there's no withdrawal, people say there's no withdrawal to cocaine, for instance, but there is a withdrawal. I think a lot of times people say there's no withdrawal because it doesn't require medications or, to treat the withdrawal. But most substances that are addictive do have some kind of withdrawal phenomenon, including, severe cravings, and that often drives people back into using. So I think treatment is important because it gives you the tools that are necessary to learn how to stay off the drugs and alcohol. And alcohol is also a drug. Yes, that's such an important point you bring up about the potency, because most of the marijuana that's found in the United States today is genetically modified. And so it's genetically modified to be more potent. It is way more potent due to the genetic modification than the marijuana that was, found in the 60s or 70s and so smaller amounts can trigger off things like psychosis, panic attacks, all of those sorts of things. I also want to just mention that, it's a very quick, for anybody who's a parent in the room, like one day your child is 16 and the next day they're like 25, or the next day they're 22. And, out of the people smoking marijuana, there are lots of young people who then in a few years could suddenly be pregnant. So now we're talking about, pregnancy and marijuana, and if they don't have any true addiction to it, then they could probably just stop. And just like they would stop drinking, during their pregnancy. But if they have the brain vulnerability, then they are unable to stop. Also, most people don't know this, even people in healthcare, physicians, nurses who don't work in the field of addiction recovery don't really see this, but we actually see people who come into treatment. I treat people who are 18 and above. So I have, in the last few years, I've seen several patients who've come into treatment at the UConn intensive outpatient program, in my addiction psychiatry clinics, who are, whose only drug is really marijuana. They don't use anything else, and then nothing terrible has happened to them. Like they haven't failed school, or they haven't some people, yes, but other people are just come into full-scale treatment because they voluntarily, because they realize, I'm just not able to put this down. I smoke every day. I spend a ton of money on it. I just don't, they're like, I'm addicted to this drug. And that's not something that if the average person thinks about, they think about people going to rehab or going to, intensive outpatient or outpatient counseling for, alcohol, for cocaine, heroin, fentanyl. They don't really think about marijuana, but there are people who voluntarily come in, and their lives are better because of it.
Yeah, and we also see now, and not everyone in the room may know, there's also Marijuana Anonymous. So we see, AA, NA, all of those now. Marijuana Anonymous is something that's grown across the country. One thing that you did touch on, Dr. Rao, was research. And we know obviously since it's not legal at a federal level, it's not something that's heavily researched. There's some medicinal research, but on the recreational level, it's not as prevalent. Mayor, I want to come back to you because you did mention your history in bringing forward legislation and working, with folks at the Capitol. What do you think is the next step? How do we overcome that barrier? Because it is becoming legalized without the research that can back it up.
I honestly don't know the answer to that question. What I'll tell you is also in the audience is Cephas Nolan. He's our Director of Youth Services. Laurence Burnsid, Director of Health. We're trying, through some of the knowledge and experience that we have, we're trying new things. So for example, we've added a social worker that's embedded between the health department and the police department, because not every call needs a police officer with a gun, a badge, and taser. So it's not that this social worker will be, the point of the spear, so to speak, but we have recurring calls where somebody has anxiety, 911 is their recourse. So if we can pull those calls that are mental health related, and again, this is more topical, it's not root cause where, we know we know what to do and how to stop it. But for a community like East Hartford, CFIS is in the school system. They're trying different things with the children. The school system's aware, whether it's the teachers, the principals, the administrators. Laurence has a variety of programs. We are partnering more than we ever have with places like Intercommunity Mental Health, Choice Healthcare, First Choice Healthcare. So I would say I'm not smart enough to know the answer to your question, but topically, we are smart enough from the experiences to know that we have to have bolt-on programs like social workers instead of police officers to manage some of the things. They're not all caused by, smoking marijuana at a young age. They could be, but it's really an embracing by the community that mental health doesn't visit just certain families. Little bit of a funny story, when my daughter was at the Institute of Living the first time, one of the things they ask you is a questionnaire. Is there any mental health in your family? And I was approximately 50 years old and I'm going, none that I know of. So I go back at home and everybody starts to come clean. Oh, Aunt Sue and Aunt Ginny and Uncle Bill. Oh, how about Frank? So, from this, one of my daughters is an occupational therapist, the other one's a social worker. They're in support of, in addition to a primary care physician, you should have a mental health exam once every 1 or 2, 3 years to measure where your baseline is. I actually support that in light of what we've been through. I'm going, yeah, that makes complete sense. So I think what you're seeing really post-COVID, COVID brought out, mental health issues that I don't think we ever contemplated due to the pandemic. Communities, whether it's the Root organization, whether it's the town of East Hartford, we're combating what's affecting our community in a health and possibly a negative way with support, with understanding, with acceptance. And finally, the legislature, whether it be federal or state, is putting money in place to really improve everybody's quality of life, no matter what degree or what variety of mental health issue you may suffer from. And I think that's the takeaway that's positive. But to answer your question, I'm not sure, I'm not smart.
Anybody else have anything that they can add? You look like you might have something to follow up there.
1 in 4, right? So 1 in 4 people experience either a mental health issue or substance use issue. So of course, many families. I think that I'm sorry, I wouldn't be doing my job if I didn't say, could we stop calling it stigma and call it discrimination? Because that's what it is.
Yep.
I bet when your daughter was at the Institute of Living, nobody brought you a casserole. That's what we used to say, because you went in for heart surgery, when a neighbor would bring over a casserole. But your kid goes in because they need psychiatric care. Nobody talks about it. So can you tell it's my passion. I get really crazed about this stuff because I really think that it keeps people out of treatment. It keeps kids from telling their parents when they're in trouble. I mean, I think there's a lot of issues with how people feel about mental health issues that create a big part of the problem. So it's really helpful when people, especially in positions like you're in, come out and tell a family story, because that gets other people talking. I don't think I've ever told the story of my brother, by the way, publicly. Honestly, never thought about it, but it wasn't so much that I was ashamed of it. It was a weird time in my life. It certainly impacted me becoming a psychiatric nurse. So I think that people do go into these fields often because of a personal experience, which I think also is helpful sometimes.
We obviously don't hope for more of these cases, but perhaps in seeing more of these cases as it's becoming more and more legal, then perhaps that conversation will get started, that research will start to get moving. Something else
There is, I just want to say there's great research going on at the IOL. And there's actually a published book already out of that research by, I'm going to forget his name, on the impact of marijuana. So they've done a lot of driving research. They've done a lot of work around what the impact is physically on people as they use marijuana. So we're getting there, but there needs to be a
now
lot
it's getting to a
more.
larger scale. Yeah. Something else that Dr. Rao had touched on was the potency. We talked a little bit about the potency. Eric, I'd like to come back to you to speak a little bit about that, because obviously, as you said, it might not be the weed that maybe, people saw in the 60s and 70s. And can you explain a little bit about what that potency means to someone who has no idea, you know, what those percentages mean and how that can really impact the person going forward if they were to use cannabis?
Totally, Margaret, I'm glad you asked. I was gonna raise my hand and try to chime in. So, so in the 60s and 70s, it's thought that cannabis maybe, I've heard as low as 1 to 2%, more often 6 to 7% of THC, which is that psychoactive intoxicating component. Now in dispensaries, we have cannabis flower with 30-35% THC. So that same component before sometimes 5 times as concentrated as it was in the 60s, 70s. That is due to the genetics of the flower. There's companies whose whole job it is to crossbreed flowers until they find a strain that does well in the conditions, depending on the geography, indoor, outdoor, how it grows, how it dries and cures, and then how it holds up at a dispensary. So someone who I had so many patients, you know, when you start talking about this, like, oh, when I ask, do you consume cannabis? Like, I haven't since the 60s or 70s. I say, all right, well, you're basically a blank slate. Like, we're gonna pretend like you never did, because that doesn't even count with what there is now. So the lowest potency flower maybe is 10 or 11% THC, just for perspective. So the market, unfortunately, is driven by THC percentage. So if you look at something like the alcohol market, ABV has something to do with what people consume, but it's probably more of a flavor profile, branding, that kind of thing. I think the cannabis industry will get there. There's more knowledge now about what makes the certain strains have certain effects and certain aromas and flavors. But right now it's pretty much dominated by the 3 lineage types: sativa, indica hybrid, and then that THC percentage. Even those 3 lineage types, could I see a raise of hands who has heard of sativa, indica hybrid before? Okay, so about 3/4. So cannabis sativa is the scientific name for all cannabis, but the 3 lineage types that are generally used in most dispensaries and in any market really is indica sativa hybrid. Indicas tend to be more sedating and pain relieving. Sativas can be really stimulating, energizing, but really can worsen anxiety for a lot of people. And hybrids are somewhere in the middle. So any product on a dispensary menu will be labeled with this lineage type, which gives you an idea of maybe what type of effect it could have on a person. So when we're talking about the raw flower that's either combusted or vaporized, that THC percentage could be as high as 30-35%. Connecticut actually set a limit for adult use products that they can't be more than 30% THC. But to be honest, someone who isn't used to cannabis, whether it's a 15, 20, 30% flower, they're probably going to feel very similar effects, because your receptors for THC are called CB1 receptors. They're present in the central nervous system. That's what THC interacts with to produce psychoactive or intoxicating effects. It can only bind so much THC. So there is also products though that are extracted from the plant, which can be much more potent, even into the 90% THC, almost completely THC with very little plant material or oils. So this could be in a pre-filled vape cartridge. Obviously, of course, everyone's familiar with vaping. There could be another way they're consumed called dabbing, which is when a small amount is vaporized all at once. So I could compare it to, let's say, smoking a joint is like sipping on a Bud Light, a 4% beer. A dab is like taking a shot. It's getting a high concentration of that intoxicating component all at once. That can be very overwhelming for people, certainly people who've never used cannabis before. Then there's the other side, if we go away from inhalables, with edibles, which everyone has probably heard about by this point in time. Dosage is so important with edibles because they go through the liver before the bloodstream. So when you smoke or anything that's inhaled or goes under the tongue, such as a tincture, it goes right into the bloodstream. There's no metabolism involved at that point in time. So the effect is produced quickly and then wears off generally not 1 to 4 hours, you could say, with smoking. With something like an edible, it's going through the liver through first pass metabolism before it goes to the bloodstream, gets metabolized from THC to something called 11-hydroxy-THC, which has an even longer half-life and is even more potent, has a stronger affinity for that CB1 receptor. So someone who smokes all the time could think they could take a big edible and be okay, And that totally is not the case. It's gonna produce a very different effect than smoking. So in Connecticut and most, I should say, not most markets, but Connecticut and Massachusetts, 5 milligrams of THC is the recommended dosage for an adult. So just like one 12-ounce beer of certain ABV, say forget for wine and liquor what it is, 5 milligrams is sort of considered the gold standard, where most people could take that and feel comfortable without experiencing side effects. That being said, 2.5 milligrams for some people is enough to produce psychoactive or intoxicating effects. So dosage is so important. You hear about people making their own brownies. I don't love that because you never know exactly how much is going to be in there. And people really have to understand it can take 1 to 2 hours to kick in before you feel a thing. So everyone probably has either experienced themselves or heard a story of a friend who made brownies, ate one or ate a quarter, didn't feel anything, ate the other quarter, ate the whole thing, and then all of a sudden it hits you like a brick wall. Super, super common, and it's really just due to the way that THC is metabolized and then hits different. So there are edibles in our market on the medical side that could be 100 milligrams of THC. There's edibles in other markets that could be literally 1,000 milligrams of THC. I won't even get into the gas station stuff, guys. That's like maybe I should, because that's actually probably the way a lot of adolescents get their hands on these things. So let me go there for a moment. So in 2018, there was a farm bill passed that legalized CBD. CBD on its own, very inert. It's not intoxicating. It can produce for some people some sense of relaxation, some sense of calm. Some people report it improves sleep. Maybe it's good for inflammation and pain. When all is said and done, CBD can be consumed in larger dosages without the risk of serious side effects. They could cause diarrhea. For some people, it could be stimulating or too sedating, but in the end, not so bad. What they've now figured out how to do is convert CBD from the hemp plant. And all hemp is cannabis with less than 0.3% THC by weight. It smells like cannabis, it tastes like cannabis, it smells like cannabis, but it is not having those psychoactive properties. But they can take that CBD molecule, enzymatically convert it to delta-9 THC, which is the same thing you find in a dispensary. And that right now is in this legal gray area, and it's sort of state by state. The FDA is starting to figure out how to control this. But that's why you see THC edibles and vapes in a smoke shop or in a gas station, completely unregulated, not overseen by any governing body. They're starting to crack down on some of this, but that to me is the access point where a lot of kids could get their hands on something that could absolutely be harmful. These things could be shipped from California. They could be made by anybody, anywhere. It might say 50 milligrams per piece. Does a kid know what that means? Definitely not. I know just because I'm in the industry, I like to go into different places that sell these types of products just to see what the knowledge base is of the employee selling them. And this employee offered me a gummy that was 50 milligrams. And I was like, no, thanks, but do you have any idea like what this could do to somebody? And he's like, no, I just buy them and sell these things. So that's why these conversations are so important. And while the legal route of getting cannabis through a dispensary, being 21 and older, everything in our stores and any store in Connecticut is third-party tested before it comes to the dispensary. So you know exactly what's in it. You know that there aren't any harmful components of the plant or cultivation process, such as heavy metals, pesticides, that can end up in a consumer packaged good. Those aren't in a dispensary product. The gas station, anything could be in there. And I'll jump off my soapbox now.
I'm not gonna have you stay on that.
All right.
You mentioned vapes, and that was one of our forums a couple of years ago, and now we see also, which is something that would not have been around back in the 60s and 70s, and that's where we're seeing those really highly concentrated numbers, 90% and above. And for kids, that really was an issue that we were seeing, is the kids were finding the jewels, they were finding these pens, and now there's all these off brands that are in the gas stations. Can you talk a little bit about what those vapes are, how they can impact a person? I mean, you touched a little with the edibles, but this is also kind of taking it up a whole other notch.
For sure. So essentially vape is, the oils are extracted from the plant. So you start with the raw plant. I can't speak to tobacco, but this is just with cannabis specifically. There's different ways of extracting THC from it, whether it's the use of chemicals or just pressure. But in the end, you get this oil. You could say 1 gram of oil is equivalent to 7 to 10 joints. So 1 vape cartridge, if someone were to consume that whole thing in a day, which I'm not saying people do, but just for perspective, that's like smoking 7 to 10 joints. So it's no joke when it comes to potency. In illegal markets or illicit markets, vitamin E acetate was being used as basically a filler in vape oils, and that's what was causing a lot of lung damage. This was 2018, 2019, so right when I started, this whole thing was happening, so I could very quickly get caught up. In a legal market or a well-regulated market, I should say that is not the case. It's really just THC, CBD, if there's any present, and plant material. With these things though, they vaporize, it's not combusting, so it's not as high of a temperature off a product that's being breathed in, but it also doesn't feel like smoke. So kids might think they're not really getting anything when they really are. It's really more like warm air than it is like smoke. So when I used to be in the store and educate patients, I'd say literally start with like 1 to 3 puffs, wait 15 minutes. That might be enough to make you feel what you're looking to feel or get the relief you're looking to have. So, and again, what we have is very well labeled and tested with things in a gas station. Who knows how much of a THC component there is, and who knows what other junk is in there that is then going to be inhaled and absorbed into the bloodstream.
Thank you. Yes, more.
I'm glad you brought that up because exactly, it's very important to reference about access, because that's another question we asked in our student survey. And when we asked them, where do you feel like your peers are receiving marijuana products, 2/3 reference that they get it from friends, not surprising. 2/3 also reference that dealers, so just other networks of acquaintances that they may not consider friends. And then over 1/3 reference web-based sales, which, it's great that we have the policy in place, so we have regulated sales and regulation of the actual concentration, delivery, who it should be sold to, inventory tracking. When you get onto that illicit sale through web-based sources where you're just getting them from some company that you find on the web, you lose all control of that, which is very concerning, because you might have some ages marks. Yes, I'm 21 and older. I'm using a friend's credit card, that's of age to go ahead and order this, and they receive it. And as referenced, the severe acute lung disease multi-state outbreak that occurred back in 2019, yes, vitamin E acetate was specifically identified as one of the causative agents when it came to causing the severe lung damage, because the oil was not combusting and essentially coating the alveoli and just destroying it from lack of air. But from that investigation, I was involved with a prior job in that we, in addition to finding cases to identify the source, which overwhelmingly the source of purchase was through online sales from a lot of the young adults and teens that were getting their hands on the products that were implicated in this large outbreak. But we also tried to obtain the cartridges or the products that they purchased or recently used right before illness, and obtain those and send them off for analysis. And we were finding, or through FDA testing, concentrations were being found of nicotine and cannabis or THC anywhere from 40 to 95% concentration in the cartridges. And these are individuals that just did not realize that the concentration was that strong, which in some cases with nicotine, they were comparing to just one single cartridge was, the equivalent of an entire pack of cigarettes that you would use in one sitting potentially. So, I think that's where we kind of come back to the policy part of this, and also the research that you're talking about, which is that understanding that we may have addressed one problem, which is, decriminalizing the issues with marijuana use, and setting up a system for controls for adults. But then we're still going to give teens access it through other sources that are not really regulated, not controlled, and there's still really inherent problems with those that we have to really understand, which comes back to also the education component and making sure that both adults, parents, and the actual adolescents themselves understand the inherent risks that they're taking on with initiation of those products, so they can really kind of understand why we're trying to limit their use for these.
And Margo, can I just piggyback off of that? So great point to that. I think as I'm sitting here as a clinician by nature, I think like, okay, if I'm an adolescent, I'm hearing all this, am I even understanding what I'm hearing and what that even means to me? And I don't. As an adolescent, they don't understand any of that. So I think going back to also what the mayor had mentioned too, getting into the school system, starting that education early is super, super important to be able to address it head on as early as we can, but also provide that education to parents who most will be able to grasp that concept, to be able to teach their kids and school personnel as well, to provide psychoeducation to teachers and staff and faculty to be able to provide that education to students is super important as well.
I also think we underestimate the impact of parents on kids, right? So it's really critical that parents let their kids know that they don't approve of this. And that, you know, they don't want them to do this. That will, for some kids, work, not for a lot, but for some. And so I think it's really important that parents don't feel like they can't say, no, I don't want you to do this, because for some reason they're not allowed to go in that direction, which is kids do listen to what their parents say, even though they've been tempted down.
And providing education to the parents too, right? Because I feel a lot in my experience at the clinic working with families, I have parents that'll say, I have a medical marijuana card and I know that my child smokes marijuana. I would rather they get it from a medical facility instead of going and getting it on the street, because at least I know what they're putting in their body. And then they'll follow that up by saying, but I don't want them to smoke and I don't approve of it. So in my experience, and what I do is providing education to those parents to say, hey, look, let me help you understand what this is doing and what the long-term impact has, to be able to motivate and give you the confidence and give you back that support, right? That you're not doing this alone. We're here as clinicians, as everyone on this panel, to be able to do this alongside with you, to provide the education to the kids. And you are in a position to be able to do that. You don't have to be the parent and be the best friend all in one.
I think these are all great points that we've touched on. I want to leave some time for public comment. So whether on Zoom, if you want to write it in the chat, and Joe and Heather can let me know, but I want to open it up to the audience if there are any questions or comments based on what we've heard so far. You raise your hand, I'll bring the mic to you. All of this scintillating talk and no one has anything. Introduce yourself and then ask your question.
Cephas Stone, East Hartford Youth Services. One of the things that did come up with our survey were a lot of kids felt that marijuana, cannabis use was great for stress. And stress and anxiety is like running rampant in schools, especially in the last couple of years. So I guess the question or comment would be, how do we combat that message? Because one of the things we're hoping to do is get a public campaign to educate kids. And that is one of the that's one of the items that I think we have to really hit on, that it's not going to be all that helpful for you, stress and anxiety.
Dr. Rao, what we get you to weigh in here with your psychiatry background on, folks using it as a coping strategy for their anxiety, for their stress?
Well, what I would say is this, that, when we speak, when we're speaking to young people, I agree that the education should start like way before high school, because you really have to start at the elementary school level, so that, and you put it in simple terms for, little kids, so that by the time they get to high school, they already have some understanding that any kind of potentially addictive drug has risks, right? And I also think that we have to be honest about the fact that all drugs of abuse have medicinal and positive aspects. Otherwise, nobody would use them, right? So they all have some degree of medicinal uses or medicinal aspects. If alcohol was invented today, it would be a medication, it would be a controlled substance probably. But so I think for many, many people, marijuana probably does relieve stress and anxiety, just like if you're having a really stressful day and you have a glass of wine at the end of the day, you're less stressed, at least temporarily. But if you have a strong family history of, any kind of, a family history of any kind of addictive illness in your family, or you have some, risks of, or you're somebody who suffers from depression and takes antidepressants or whatever, then, falling into that pattern could be a very risky thing for you. So I think I think we have to be honest with young people and not just say, okay, it's all bad, you know, you're gonna lose all motivation, you're gonna have car crashes and things like that. Because at some point then you just lose them in all the details. And also they're seeing people around them using, and none of these things are happening to them. So I think it's better to not underestimate them and present the information more nuanced to say, look, there's lots of addictive drugs in the world today. As a society, we've tended to develop this sort of bifurcated attitude where what we consider quote unquote hard drugs like, you know, cocaine, opioids, we demonize them. And at the same time, there's a much more and more of a relaxed attitude towards alcohol and marijuana. And also there's a generational difference where for the younger people today, they think of marijuana the way somebody in my generation would think of alcohol, right? So they don't consider it this like illicit drug in many ways. So I think we have to kind of educate them to say, look, yes, it probably does relieve stress, but do you really want to take your developing brain and start, you know, start potentially damaging it by taking something several times a week that is, you know, can have some long-term very negative consequences. More so when you're below 21 or 25 than when you're 30. Not that if at 30 you start eating a small tray of edibles every day, that's not going to harm you. Does that answer the question?
I think so.
Anyone else? Questions?
Chris has one.
Oh, let's see. Let's move that. How does harm reduction fit? Oh, hold on. This is Chris, our director of nursing.
I can read it out because I can see it really clearly.
Conversation knowing that teens are smoking marijuana. To Ashley's point regarding the parents' response, that they are more comfortable knowing where the substances are coming from. Is there a harm reduction approach to consider in which perhaps the benefits outweigh the risks?
Boy, Chris couldn't ask an easy question.
You keep that. Did you guys get that up there? Yeah. Went to Ashley's point, so I don't know if Ashley wants.
Yeah, so I don't have an easy answer for that. I don't have an answer at all, but what I can say is from experience being a clinic supervisor and starting in school services, and we're currently in 7 school districts right now. We use harm reduction. We practice harm reduction. We're not going into these students and saying, stop using marijuana right now. You shouldn't use marijuana, or you should do this, or you shouldn't do that. It's more of, again, providing education and also building these students' toolbox to say, okay, yeah, marijuana is easing your stress maybe. And okay, you have anxiety and marijuana might be helping that anxiety, but let me give you some other things that might also help that anxiety or might also help with the stress. And let's practice those things together and work through it together to see if this strategy gives you the same benefit as the marijuana. And we're gonna work through that. And then we're gonna revisit the conversation of, now, which one do you feel is a healthier option for you? And I think that there's not one shoe that fits all. I think, and especially when you're talking to adolescents and telling them with this approach and kind of like she was mentioning before, don't do this, they're gonna do it, you know, and to be able to give them an option and give them a choice with their own life goes a heck of a longer way with them than giving them, you have to do A, and A is the only choice for you. So to Chris's question with this harm reduction, I think that really is what it's about, is giving them control of their life, so to speak, and saying that you have options, right? And whatever you choose as clinicians and as therapists, we're going to be there to support you, whichever way you choose. But it's my job to kind of lay that path out for you. So if you go path A, this might happen. And if you go path B, these things might happen. And I'm going to provide you education and that psychoeducation along both ways, and let's go down it and see what happens.
Chris, that answer your question? Thumbs up. All right. Anyone else? Another question or thought? Yeah.
Going back to Ashley, so I'm Heather Porter, Norwich Root Center.
This is Heather, one of our counselors from Norwich.
And I liked the aspect that you were talking about with regards to education of parents as well. I'm a parent, I have an adult son who has is in recovery. So I get that aspect of it. But I think knowing, and I think Dr. Rao talked about it as well, is having that conversation and having the parents be able to talk freely with their teenagers about that too, because a lot of teenagers feel like they can't, this isn't something that they necessarily feel free enough to talk about with their parents. And, I just found that very important. And I think in my life, it's been very important to be able to sit down and freely talk about what it is, the stress, everything that has, indicated with that.
Yeah.
So thank you.
Yeah, of course. Anyone else? Comment? Oh, all right, hold on. Welcome right back to you, Sherry. Introduce yourself.
So something that I was thinking about when it comes to harm reduction, to make it HIPAA compliant as possible, we had a patient that came into the community for opioid use disorder. And something that was pretty concerning was that he came in and he asked questions as far as, when's the last time you did opioid use? He was like, oh, I don't do opioid use. Injected. Oh no, I don't do that. I was like, you're here for opioid use disorder. And he said something was like, well, in the middle of a pandemic, this was back then, the pandemic, he was like, it's hard for us to have masks. We can't find masks anymore. And I said, so are you using heroin to use fentanyl? He said, well, we're not using masks and I'm a lineman. So then I kind of eased back a little bit. I was like, what's being your alignment? He was like, well, my job now is to put a little bit of fentanyl into marijuana in the street. And it kind of concerned me, and I was pretty interested in what he had to say. I was just helping out in the clinic. And I was like, what do you mean? And as a human, I was mad. But I was happy he was like, oh. He was like, well, right now, marijuana is pretty easy to get legally, and we have to make it cheaper, and we have to get them addicted to other things. So I'm the toothpick guy. You toothpick guy. He was like, well, we put a little bit of fentanyl to the minus, like the most minutely possible, and put it on marijuana. We need to get people addicted to something else so we can be their customer. So we're basically sampling at this point. And I said, is it for marijuana? No, it's for them to get hooked on something else, because marijuana is going to be legal. So when we think about harm reduction, I'm happy about recreational heroin. So the fact that we can see a pharmacist or a PharmD and they can actually know exactly what's in it. Because at this point, there's people out there that are actually getting help because they're hailing that. They're hailing other things to get them hooked on something else. So at this point, some people are getting hooked on something else, and what if they have them out there and it's way too much? If we know half of rice grain is legal. So it's something interesting to know that if you can go to a pharmacy to get marijuana, I'd rather you get it that way than to the street. Just because, if I like a 12-inch bourbon, I'm not going to get it on the street. Oh, hey, I'm going to charge you $1 for a whiskey. I'm not going to grab it because I'm like, what do you mean you're making that in your house? So it's the same thing.
Well, especially because the kids are not going into the dispensaries, right? They're not of age, so where are they going to get
It's
it?
something as far as even of age or anyone that's above 21 years old, that still goes to their dealer. It's something that I think is important to think about. That there's people out there that are unfortunately lacing this to get you hooked on something else. So we'd rather have you take the route of the legal way, that we know exactly what's in it.
And we obviously heard Eric had stories and stories to tell, all this information that's important to have. Sherry, our Chief of Human Resources here, he has something to say, so.
I really appreciate it. The mayor's story. I have 2 kids in college, and I have a son who's 19 and had some anxiety concerns. And one day I went into his room after telling him to clean it for like 6 weeks, and I couldn't take it anymore. So I went in there to clean his room, and I found a stash of energy drinks, right? You think kind of, well, that's harmless, they're energy drinks. There's a lot of energy drinks in there. And I remember, going to the pediatrician right before getting him ready to do it in college, and kind of let's talk about the energy drinks a little bit, because that's an addiction too within itself. There's a lot of energy drinks in this room, and kind of interesting to me, I think that my point is pediatricians. I think that's something too, as we look at legislation and we think of different venues. It was really interesting to me. There was a lot of, the vision test was done in your height and your weight and maybe a little bit of a questionnaire, but even when I brought up the energy drinks, it was kind of not taken too seriously. And I just wonder, to the mayor too, when, your daughter, was the age of my son, and there's certainly a lot of anxiety, there's a lot of self-medicating, but and when you spoke about kind of not having too many options to get some quick care, and just say pediatricians is an avenue that we need to talk about too, because it's certainly something, Pat, to your point, we talk about a lot of, we would do, cancer screenings, and we would talk about heart disease, but this is something that absolutely our teens are 100%. There's a lot of anxiety happening. COVID, certainly, I think, having 2 teens during COVID, that I can testify completely changed the way teens are dealing with anxiety. So I do think having more resources and even starting to weave in the pediatricians, their doctors certainly, but addiction is not their specialty. So just, I don't know, some food for thought as I hear all of you speak about that.
So one of the things that Hartford Healthcare was actively doing before I left was they were putting clinicians, either health psychologists or social workers, into primary care. And there is a statewide line for pediatricians to call so that they can get a psychiatrist on the phone immediately to answer questions about medication, substance use. I don't think they're doing the screenings in pediatrician's office, which they should be. We are doing depression and anxiety screenings in adult practices, and it really is critical, and pediatricians need to do more of it. But there is actually a number they can call. So, and they do. They are very clear that they don't know how to deal with this. And there are people out there that can help them.
Jane, to say we.
Let me just, I was gonna say it's best practice, right? It really is what should be happening. And I know when I go for my physical, I have to do a pH 9 or something.
Well, and I think just hearing, and this is my own 2 cents now, is obviously we know about the tragedy that happened at the bank in Louisville a few weeks back, where the young man went in and shot 5 of his colleagues. And I don't know if you saw the interview with his parents. They were on GMA or the Today Show, and the parents were talking about all of the steps that they went through to try and help him. And one of the things that struck me was the mom, when she said she went to call the doctor saying she needed psychiatric help for her child, it was, well, we can see you in X number of days. And she said, no, I need this now. And I think that's a barrier. And obviously that is a whole different, story or case of mental health that we'd be discussing, but the access to care, there's still such a problem in this country, where I know for me personally, I'm trying to get an appointment with a physician and they told me they can see me in September. It's not even June. Now imagine if that's a parent who has a story like Mayor Walsh shared, or like your brother, and that's a whole other can of worms of how do we fix that to be able to even fix the problem? Because if we do have a child who's exhibiting these symptoms, but we can't get them seen, we can't get them treated, how do we make advancements in that? That's just my little 2 cents.
Let me throw a couple of things at you. In my particular case, again, we were supportive parents. We had great medical care. I worked for the town of East Hartford as the finance director. I administered the health plan. So, when the doctor admitted my daughter, they're like, it'll be a 3-day hold, maybe 5 tops. Well, the 25th day, the 26th day, the 27th day. The insurance company is now involved, and they're like, get the kid out of there. And I got on the phone and I go, leave the doctors alone. Not everybody has that ability. So there's a 2-tier health system. If you got it, you got a supportive family, you have a chance. But how about the people that don't have medical health care, or have state care that perhaps isn't as good, or don't have care at all? And, too frequently our police or fire, they bring somebody to the emergency room and they will not get an inpatient stay. They're probably deserving of it, and they're back out on the street. So America, without a doubt, has a 2-tiered healthcare system. Those that have it and those that don't and don't have access to it. So We have only begun to scratch the surface in programs that Laurence and Cephas put together, try to bring healthcare into the community. We opened up an Access Health Connecticut office in the basement of our library. This isn't about mental health and this isn't about marijuana or vaping smoking, but it's a statistic that just stuns me. If you are born in certain sections of East Hartford or Hartford, compared to West Hartford, your life expectancy is 17 years lower. That's a two-tier healthcare system that is only 5 miles apart. That's the stuff that bothers us, and that's the stuff that policymakers need to deal with and create a fix for.
I think certainly a lot of different topics that we could have community forums on in and of itself. There's a lot that's been touched here. Anybody else? A final question from someone or comment? One of our board members, introduce yourself.
Hi, my name is Bill Schumann. Thank you, panelists. Fantastic information, really insightful. My question is really around where the government's at. Because Ashley has a great line, the difference between parenting and a disciplinarian. Parenting is hard. And I'm fearful for 17, 18-year-olds because you're right, they're not at that point. They really do risk. But parents need to help them through that. And with this wave of acceptance that's coming along with marijuana right now, that's a big challenge. So, you know, I go simplistically with the Surgeon General. Is there science to support them coming out and say, hey, this drug will affect your brain, and you're going to need it later in life. So you really have to have what this drug means in your life right now. So from a government perspective, is there a movement there to release the type of statement?
I don't think there's enough research yet. I think that's really the problem, that it's very hard. I actually was reading some articles today about this, and even though there is good research going on in Connecticut, it's pretty limited. And so I think it's hard for people to come out, the government to come out and make that kind of statement. And I think in some ways, these kinds of issues have become politicized in a way that's not helpful. Because if these are politicized issues, we're not going to look at the research. We're going to look at what party do I belong to and how does that make me vote? And I think that's a problem with some of these issues, because decisions can be made without, the full data that we need. We really need data about this.
Let me unvarnish what you did. First off, that was wickedly politically correct.
I was a commissioner.
I'm not that right. On the debt ceiling, we're playing political chicken with all of our financial livelihoods. We just got through a pandemic, and there's a school of thought out there that throw the science the heck out and let our immune system kick up, and to hell with everybody else. So unfortunately, we are now in a world of alternative facts. We are not science-based anymore. We seem to be gravitating toward places that I'm a centrist. I was a Republican. I am a Democrat, but I'm a centrist. And there's nothing on a national level that troubles me more than alternative facts. So I'm not optimistic that even if the science was there, we could coalesce around what's right for the country. And look no further than the debt ceiling game of chicken that they're playing.
One thing I want to address is one of the key barriers to getting this data is cannabis is federally illegal. So it is as illegal as heroin. In Connecticut, of course, it's medical, and now adult use. There's, I think, 40 states where it's medical. Here in Connecticut, it's considered a C2, just like something like OxyContin or Adderall, which is why it is held in the storage within our facilities that it is. There is one medication called Marinol or Dronabinol that's a synthetic Delta-9 THC that's used for cachexia or cancer patients who need to stimulate their appetite. But that is not a whole plant extract. It's completely synthetic. You can't take any learnings from that and really understand the cannabis plant, which the plant itself has over 200 compounds in it. THC and CBD are two that people have heard of. Terpenes are another component that people have heard of, but there's tons and tons of what can be active components that we're still learning about. But until it's federally legal, which I don't see happening anytime soon, it's really, really hard to do compliant research with this plant. Yale actually did partner with one of the producers in Connecticut, CT Pharma, to do a study, and they used measured amounts of THC in capsules, and I think the endpoints were pain and sleep. But there's nothing going on nationally that can really tie together the learnings around this plan.
Great. And if anybody else? I think that's important. I think that's why we like to do these community forums, as we're talking about, there is a need for more conversation. There's a need for legislation, for research. And the more we get together and we have these conversations with people who are at the table in different capacities, then hopefully you go home and you tell your counterparts and you tell your friends and your family, and we share these videos and we spark these conversations with the hope that it does go on to help more people. And we do go on to solve clearly the gaping holes that we have and the problems here that arise, and that lead to one thing or another. And we all have a job because of these issues, those of us who are in this field, unfortunately, in that regard. So we thank you for coming. We hope you guys got as much out of it as we did. Oh, yes.
She has a question.
Oh, hold on. Let's finish with, we got another chat question.
Dr.
No, Dr. Rao, yes.
Comment. So my comment was that there is a lot of research on marijuana, both medicinal properties and its risks, that is done internationally. So, human beings are biologically, everybody in the United States has ancestry from somewhere else. So we're pretty much a mirror of the rest of the world. So there is a lot of research from around the world. A lot of it is really sort of equivocal, where, it's like there was this big Australian study that showed that, teenagers who smoked marijuana, young people, their IQ levels dropped by many points. Then another group did some analysis of their study and said, this is wrong. Then the Australian group redid sections of their study and said, no, we're right. So what the mayor was saying, where the politics are not just here in the United States, but there's also the politics of people who think of it as a medicinal drug, which, as I was saying, like every drug of abuse has some medicinal properties, and then people who think of it as, what about the risks? So I think that is also mirrored in international research. So but the research so far, which there's tons of research in the rest of the world, is not, it doesn't show anything so dramatic that you could hand a paper to a young person and say, this is for sure going to happen to you, the way you could hand them something about, like, I don't know, cocaine, So that's important to remember, because our younger generation is really smart and they have a lot of information as well. And so I think it's important to discuss the risks without being so, without trying to demonize it, so that you don't lose them in the process.
All right, with that said, thank you. Let's give a round of applause to all of our panelists. And then come out and give our insight. Thank you all for taking the time out of your day to join us, share your feedback. We have a ton of food, basically a tray for everyone in some shelter. So help yourselves, stay, giggle, chat, and of course, stay with us on social media and on your email list, because we do look forward to doing more and more of these in the future. So have a good rest of your night. Thank you.